A stands for A1C. It has another term called HbA1c or glycated hemoglobin. It is a test to primarily measure the 3-month average blood sugar level and can be used as a diagnostic test for diabetes mellitus and as an assessment test for glycemic control in people with diabetes. The test is limited to a 3-month average because the average lifespan of a red blood cell is 4 months. Glycation is a term we use to define or determine the attachment of sugar to hemoglobin. So, who should get tested and when? Even if your result is normal, but you're over 45 years old, have risk factors, and have gestational diabetes, the recommended screening of HbA1c is every 3 years. The other one is every 1 to 2 years if you're prediabetes. Another reconfirmation test is if you don't have symptoms but have high HbA1c result. There's no specific or special preparation in getting tested for HbA1c. The normal HbA1c result is below 5.7. Prediabetes status can be determined or be stated are those with HbA1c result ranges from 5 to 7 to 6.4%. This category should seek doctors and modify diet to prevent full-blown diabetes. And diabetes can be concluded if a patient has more than 6.5% of HbA1c. There are factors that can alter these results. Number 1, certain diseases like kidney failure, liver failure, or kidney or liver diseases and severe anemia. Second, sickle cell anemia or thalassemia. Number 3, when people taking opioids and HIV medications. Number 4, if the patient has blood loss or blood transfusions. Number 5, early or late pregnancy. When it comes to HbA1c result for patients who have diabetes, we have a goal. The goal for DM patients is to have less than 7% HbA1c result, or it depends on a patient's medical condition. And this patient should seek the doctor's advice for the treatment and also the proper range for their HbA1c.
B stands for blood glucose monitoring. One of the greatest methods to understand your diabetes and how different foods, medications, and activities affect your diabetes is to test your blood sugar level. Keeping track of your blood glucose levels can assist you and your doctor in developing a management strategy for this disease. Here are some benefits of regular blood sugar monitoring. 1. Deeper understanding about the condition. Number 2, awareness about the changes of the blood sugar level. And lastly, it's identifying proper range based on age bracket. How to prepare for blood glucose monitoring. Before checking your blood glucose levels, make sure that you have a finger stick device to prick your finger such as lancet, an alcohol swab to sterilize the puncture site, a blood glucose machine and blood glucose strip, and band-aid to prevent bleeding. How is blood glucose monitoring performed? Step 1. Hand hygiene. Wash your hands thoroughly with soap and water. Number 2, put a testing strip into the meter. Next is wipe your finger with the alcohol swab and let it dry. Prick your finger with the lancet to get a small drop of blood, and then wait for the reading. Next is put a band-aid on the punctured site, and finally, hand hygiene. Take note that if you have type 1 diabetes, you may need to test your blood glucose 4 or more times per day. This includes before and after meals and exercise, and more often when you are sick. If you have type 2 diabetes, your doctor will tell you when and how frequently you should test your blood glucose.
C stands for complications of diabetes or counseling and education. First, I will start with counseling and education. The goal of counseling and education is to prevent pre-diabetes from development into diabetes and managing diabetic patients to minimize complications. For effective diabetes counseling and education, there are a few considerations that you need to follow, which includes building rapport with your patient, your counseling techniques, communication effectively so that you can convey your message effectively, and considering the age-related guidelines for diabetes. For the parents and caregivers, they need to be educated and counseled about what is to designate to a child at specific age. Complications of diabetes. Long-term complications of diabetes develop gradually. The longer you have diabetes and less controlled your blood sugar, the higher the risk of complications. Eventually, diabetes complications may be disabling or even life-threatening. The possible complications include, first is cardiovascular disease. If you have diabetes, too much blood glucose thickens your blood, affecting the stroke volume and cardiac output of the heart or the blood circulation that leads to heart diseases or stroke. Next is nerve damage or diabetic neuropathy, such as foot problems, gastroparesis, and erectile dysfunction. Excess sugar can injure the walls of the tiny blood vessels or capillaries that nourishes our nerves, especially in our lower extremities. It increases the risk of various foot complications such as foot ulcers or ultimately require toe, foot, or leg amputation. Gastroparesis. With gastroparesis, the nerves of the stomach are damaged and stop working properly. This causes the stomach to take too long to empty its contents and make it difficult to manage blood glucose levels. Next is the kidney damage or diabetic nephropathy. If you have diabetes, it thickens our blood and it slows or decreases the blood circulation to other body parts and eventually decreases perfusion to vital organs of the body like the kidney, which leads to damage of the delicate filtering system of the kidney called glomeruli. Severe damage can lead to kidney failure or irreversible end-stage kidney disease, which at the end may require dialysis or kidney transplant. Next is diabetic retinopathy or eye damage. The other complication also includes hearing impairment, depression and Alzheimer's disease, and skin problems. All these complications may lead to severe complications like diabetes, ketoacidosis or DKA, hyperosmolar hyperglycemic state, severe insulin resistance, even diabetic coma and death if all these were left untreated. The gestational diabetes. For the complication in your baby includes excess growth or extra glucose can cross the placenta, which triggers your baby's pancreas to make extra insulin. This can cause your baby to grow too large, also called as macrosomia. It also causes low blood sugar, type 2 diabetes in later life of the baby, and even death. And for the complication in the mother, preeclampsia and subsequent gestational diabetes, which means once you'd had gestational diabetes once in one pregnancy, you're more likely to have it again with the next pregnancy. You're also more likely to develop type 2 diabetes as you get older.
D stands for dietary management. Living begins with healthy eating, and healthy eating starts with the meal planning. Food and lifestyle habits are the key to managing diabetes and will help manage blood glucose and reducing the risk of heart attacks, strokes, and other complications. There are many things diabetic patients can do to change or improve their diet, but also it is important to avoid trying to change too many things at once. According to Diabet Quebec, 10% of Canadians have diabetes and that 90% of them have diabetes type 2. The main goal is to have a healthy weight and blood sugar control. Day-to-day consistency in timing and amount of food intake. Portion sizes or the amount of food that they eat may be different for every individual, and it is also important to weight loss management. According to Canada's Food Guide, as shown in the image on the right, First, fill half of the plate with fruits and vegetables. Diabetic patients need to choose more vegetables than fruits because most vegetables have less sugar and low in calories. Then, fill a quarter of the plate with foods that are high in protein, such as poultry, lean meat, and alternative fish, seafood, or legumes, even eggs and tofu. Next, fill the last quarter of the plate with grain products, preferably whole grains, bread, whole wheat pasta, brown rice, or quinoa. Water is still the number one choice to drink. Avoid soft drinks and sugary beverages and avoiding alcohol intake. Next is careful meal planning and carbohydrate counting. Glucose circulating in the blood comes mainly from the carbohydrates or the sugar that we eat. Carbohydrates are found in many foods such as milk, yogurt, legumes, and sometimes added to cookies, cakes, and sweetened drinks. Diabetic patients need not to eliminate all carbohydrates in their diet, but instead to keep a close eye on the amount, since carbohydrates are the body's main source of energy. That is why meal planning and consultation to the dietitian or diabetic nurse is very important. Lastly, coordinating meal and medication. Eating 3 meals every 4 to 6 hours and choose healthy snacks in between if hungry. Making sure to eat when taking oral hypoglycemic agents or insulin to prevent hypoglycemia. And to know the onset, peak, and duration of medications, which will be discussed in the following slides of A to J management of diabetes. For additional points to add, is to educate patients to have a habit of reading the nutrition fact table on food labels before they choose to buy such food items. Cooking food at home as much as possible, and to avoid eating too much, use your hand to estimate the size of the serving. The thumb is equal to 2 tablespoons of portion of dairy and peanut butter. The fist is equal to a cup of rice or fruits and vegetable. Fingertip is equal to a teaspoon of portion of fats like mayonnaise or butter. The palm of the hand is equal to the 3 ounces or portion of protein like red meat or chicken. And the hand is an equal to half cup or 1 ounce of portion of snack like nuts or dried fruits. Next is E, which means exercise. According to Canadian Diabetes Association, obesity is a progressive chronic health problem. 8 out of 10 people with type 2 diabetes are overweight. Regular, moderate intensity physical activity plays a major role in preventing and treating type 2 diabetes. It can help control weight and also lowers blood glucose level, relieves stress, reduces risk of heart disease, and delays the need of medication. Exercise is a form of physical activity that is done at enough intensity to improve fitness. Resistance training, brisk walking, cycling, and jogging are examples of exercise. For an adult, it is recommended to have a moderate aerobic activities 150 minutes per week or 30 minutes per day, 5 days a week. Examples of aerobic exercise are walking, jogging, swimming, skating, and all the activities that elevates heart rate and breathing. Resistance exercises are repetitive exercise with the use of weights, machines, and resistance bands to build muscle strength. Next is to keep an exercise schedule. Perform exercises every day at the same time. Take advantage of the daily activities such as household chores and gardening. Next is maintaining a healthy weight. We can also educate patients to calculate the BMI with the use of their weight in kilograms and their height in meters squared. Next is check the blood sugar before, during, and after exercise and adjust insulin dose accordingly. Be always prepared. Carry a fast acting carbohydrate in case of emergency to treat low blood sugar, such as small snacks or glucose tablets. And lastly, wear a medical or identification bracelet in case of emergency. The key to exercise is to start slowly and build your way up.
Letter F stands for foot care. For people with diabetes, it is important that we have healthy feet. Diabetes produces numerous number of complications, and foot care is one of the most golden care for people with diabetes. Around 6 to 51% of adults develops peripheral neuropathy or have peripheral neuropathy as a complication of diabetes, and 25% of them develops foot ulcer that leads to amputation. That's why it's very important to do foot care or to know the do's and don'ts of it. For the do's is that you should always inspect your feet daily, checking for any cuts, blisters, redness, and swelling. If ever that you won't be able to check it yourself, you could ask a help from your family member or friends to check it for you. You should always moisture feet to prevent dryness, remembering not to put moisture in between your toes. And make sure to have your foot exam regularly to prevent complication. You should visit a foot doctor every year if you have a nerve damage. Then always bathe your feet in lukewarm water because people with diabetes has decreased sensitivity to temperature. It is important that the water that they will use is lukewarm. Cut nails straight and file the edges to prevent ingrown growth or any injury. Then maintain a blood sugar level within the normal limit. Check your shoes before you put them, so check the insides if there are any pebbles or if there are any worn areas or rough spots or sands or other things that could be irritating to the skin. Keep your blood flowing into your feet. You could move your ankle in and out, up and down, or you could also put your feet up when you're sitting and wiggle your toes for 5 minutes every 2 to 3 times a day. Choose a feet-friendly activities so you could check with your doctor for the activities that is best for you. It could be walking, riding a bike, or swimming. For the don't, never walk barefoot. Walking barefoot could put you at risk for injury. Also, do not smoke. Smoking causes vasoconstriction, which narrows the blood vessel, decreasing the circulation into the lower extremities. Never wear tight-fitting shoes. This could restrict the blood flow on the foot. Don't soak your foot on hot or cold water. Never use a heating pad or a water bottle or direct heat to warm your feet. If you are feeling cold, put a socks on it. Also, make sure to keep your feet dry. Never remove corns or calluses. If you wanted to remove those corns and calluses, you could ask a podiatrist to do this for you. Do not wear tight-fitting clothes around the legs or do not cross your legs for the long period of time because it can restrict the circulation in the legs. Do not use chemicals and strong antiseptics because it could be irritating to your skin and may cause injury. And do not have pedicure by non-professional. If you wanted to cut your nails, go to a doctor or ask a podiatrist to do it for you.
G stands for Guidelines of ADA in Managing Diabetes. These are based on Standards of Medical Care in Diabetes 2022 American Diabetes Association. The standards include the most current evidence-based recommendations for diagnosing and treating adults and children with all forms of diabetes. First, improving care and promoting health in populations. There are strategies for system-level improvements such as care teams, telemedicine, behaviors, and well-being. Classifications and diagnosis of diabetes. It can be classified into the following general categories: type 1 diabetes, type 2 diabetes, and gestational diabetes mellitus. Comprehensive medical evaluation and assessment of comorbidities. A successful medical evaluation depends on beneficial interactions between the patient and the care team. Individuals with diabetes must assume an active role in their care. Facilitating behavior change and well-being to improve health outcomes. Building positive health behaviors and maintaining psychological well-being are foundational for achieving diabetes treatment goals and maximizing quality of life. Glycemic targets. Glycemic control is assessed by A1C measurement, continuous glucose monitoring, and blood glucose monitoring. Continuous glucose monitoring serves an increasingly important role in managing the effectiveness and safety of treatment in many patients. Diabetes technology. This includes the hardware, devices, and software that people with diabetes use to help manage their diabetes. It includes delivery technology such as insulin pumps and connected insulin pens, as well as glucose monitoring or glucose meter. Obesity and weight management for the prevention and treatment of type 2 diabetes. Modest weight loss improves glycemic control and reduces the need for glucose-lowering medications, and more intensive dietary energy restriction can substantially reduce A1C and fasting glucose and promote sustained diabetes remission through at least 2 years. Pharmacologic approaches to glycemic treatment, CVD and risk management. Controlling individual cardiovascular risk factors helps prevent or slow coronary heart disease, cerebrovascular disease, or peripheral arterial disease in people with diabetes. CKD and risk management. At least annually, urinary albumin and eGFR should be assessed in patients with type 1 diabetes with duration of more than 5 years and in all patients with type 2 diabetes regardless of treatment. Retinopathy, neuropathy, and foot care. For diabetic retinopathy and neuropathy, patients with type 2 diabetes should have an initial dilated and comprehensive eye examination by an ophthalmologist or optometrist at the time of diabetes diagnosis. Older adults. Screening for early detection of mild cognitive impairment or dementia should be performed for adults 65 years of age or older at the initial visit and annually as appropriate. Children and adolescents. The management of diabetes in children and adolescents cannot simply be derived from care routinely provided to adults with diabetes. The epidemiology, pathophysiology, developmental considerations, and response to therapy in pediatric onset diabetes are different from adult diabetes. Management of diabetes in pregnancy. Lifestyle behavior change is an essential component of management of GDM and may suffice for the treatment of many women. Insulin should be added if needed to achieve glycemic control. Then lastly, diabetes care in the hospital. Among hospitalized patients, hyperglycemia, hypoglycemia, and glucose variability are associated with adverse outcomes including death. Therefore, careful management of inpatients with diabetes has direct and immediate benefits. H stands for the hypoglycemia-hyperglycemia management. Hypoglycemia or low blood sugar is when your blood glucose levels have fallen low enough that you need to take action to bring them back to your target range. This is usually when your blood sugar is less than 70 milligrams per dl. It is caused by too much insulin, too much diabetes medication, eating less or exercising more than usual, can cause by some medications, alcohol, underlying conditions, or reactive. Symptoms includes hunger, fatigue, shaking, sweating, pale skin, headache, dizziness, which leads to confusion, slurred speech, blurred vision, fainting, seizures, and even coma. The treatment would be the 15-15 rule. First, test blood glucose levels. Then, eat or drink 15 grams of fast-acting carbs. This may be in the form of glucose tablets, gel tube, 4 ounces of juice or regular soda, 1 tablespoon of sugar, honey, or corn syrup, or hard candies. Then, you have to wait for 15 minutes and then test again. Repeat until blood sugar levels are more than 70 milligrams per dl. If the blood sugar is too low to treat using the 15-15 rule, glucagon is used to treat someone with diabetes. It is available by prescription and is either injected or administered or puffed into the nostril. When you use the injection, inject it at 90 degrees angle into the thigh or buttocks. You have to make a note about any episodes of low blood sugar and talk with your healthcare team about why it happened. They can suggest ways to avoid low blood sugar in the future. Hyperglycemia or high blood sugar affects people with diabetes because the body has little or no insulin. Left untreated, high blood sugars can lead to serious complications. Symptoms includes feeling hungry, blurry vision, frequent urination, high blood sugar, feeling thirsty, and tingling of limbs. What causes blood sugar? It could be not taking enough insulin for the carbohydrates you eat, eating more than you planned, being inactive or exercising less than you usually do, drinking alcohol, illness, emotional stress, skipping your insulin or oral glucose lowering medications. Treatment includes taking insulin or oral anti-diabetic as prescribed. Taking insulin will help to lower high blood sugar, but don't overdo it. Moderate exercise such as walking is another way to lower blood sugar, but don't make it too intense as this can lead to stress response and increased blood sugar in the short term. Do not exercise if you have ketones. Then lastly, notify healthcare provider if blood glucose levels are higher than 250 to 300 milligrams per DL. It is important to determine what may have caused an episode of high blood sugar and make changes to your insulin or meal planning to prevent it from happening again. If other strategies to lower blood sugar are not effective, your insulin dose may need to be adjusted by your healthcare team.
Insulin is very crucial in managing the blood sugar. It could help you prevent diabetes complication. There are different types of insulin. Your doctor will be the one to decide which insulin to prescribe you based on the extent of your A1C elevation or your measurement of your blood glucose. If you have any comorbidity, your existing current or your current health status, and of course, your adherence to the insulin therapy. For the storage of insulin, it is important that you store an open insulin into the fridge 2 to 6 degrees Celsius. Open insulin vial can be used 28 days after opening and can be stored in room temperature. So make sure that insulin is given at the room temperature 15 to 25 degrees Celsius. Insulin should never be frozen, and insulin kept in room temperature more than a month should be thrown away. So for the do's and don'ts of insulin administration, first is that do rotate the place where you inject insulin. Next is to clean your skin before you inject. Cleaning the site will be advisable to prevent infection. Blood sugar monitoring regularly and write it down. Next is count your carbs before using the mealtime insulin to know the signs of hypoglycemia. And you should also let your family members and your friends know that you're taking insulin. Don't inject the insulin too deep. Don't wait more than 15 minutes to eat taking insulin. If ever you accidentally take the wrong dose, do not panic. So it can be complicated at first in calculating the right dose, especially if you didn't know how many carbs you're going to be eating and if you taken too much. But you'll get used to this along with your dietitian and your doctor. You could go around with this. Don't switch your insulin dose or stop taking it without seeing your doctor first. It could put you at risk or for a serious side effect if you didn't consult with your doctor before stopping or increasing the dose of insulin. You should be able to make an appointment with your doctor every 3 to 4 months. Insulin to carb ratio will help you how much dose would you need if you will be injecting a rapid acting insulin. So this will tell you how much insulin you needed to cover for the carbohydrates that you will be eating. Let's say the doctor said you need to give 1 unit for every 15 grams of carbohydrates that you will be eating. So the formula for this is to divide the total number of grams that you're eating to the insulin to carb ratio. So let's say the total grams of carbohydrates to be eaten to the insulin to carb ratio. Sample, you'll be eating 45 grams of carbohydrate and your insulin to carb ratio is 15. So 45 divided by 15. So 3 units of insulin will be needed for you to be able to cover this amount of carbohydrates in your meal. Insulin correction factor is used to calculate how much insulin would you need to bring down your glucose level into your target range. So let's say your doctor told you your target range should only be 120. But then before you eat, you take your blood sugar and it's 190. The formula for this is to deduct the target blood glucose to your current blood glucose divided by the correction factor. The correction factor is determined by your doctor.
J for jobs, as a layman's term for vaccines, so means vaccines for the impatient. What are the vaccines needed? The vaccines needed are for influenza, pneumococcal, tetanus, diphtheria, and whooping cough, hepatitis B, shingles, and the recent one is COVID-19. Why we need vaccines? Or why vaccines are important for you? For diabetes, even if it is well managed, it can be harder for your immune system to fight infections, and they are almost 3 times more likely to die due to COVID-19 and other vaccine-preventable diseases. That's why during this pandemic, diabetic patients are prioritized for early vaccination since they often experience severe effects than people without diabetes. All these vaccine-preventable diseases can cause elevation of your blood glucose to dangerously high level. Immunization is very important because it provides the best protection against all these vaccine-preventable diseases. Vaccines are one of the safest way for you to protect your health.